also you mentioned some correspondence. We've also received some correspondence from them, but we will also request from you all these correspondence that you've been mentioning during the course of your intervention. You please make them available to us, so that we can also have evidence for us that so and so was done from the side of the ministry. That is very important. So if you have them here, you can hand them over to the secretary so that they can make copies available to honorable members. But if you don't have them again, you can make them available at a later date so that we can have them in hand. So thank you very much for that. And then, as you said, unless maybe some of your team members, if they have further information regarding the matter, not necessarily repeating what you've already said, because we know you are all officials and then you are all manding offices, you leave all your busy schedules to come here, though it is part of your official functions, but we should definitely be very much cognizant of time to make sure that other services also don't suffer. So unless maybe if you have other issues that you want to add up to what the PS have already said, not necessarily repeating, your team members are welcome to also set light on the matter. Thank you. If not, then I invite honorable members to come
in. Thank you. And it's another new Minka, so. Sorry, it's because I'm next to a Jaranka, that's why. So our apologies and thank you very much for allowing us to come here. And just to, like I said earlier, I'm the Director of Health Services. And as you know, this interruption in the work is really affecting the services that we need to provide for the population. And it's very important that we have a common understanding of what is going on. But just like it was earlier mentioned, this has been a grand plan of the minister to see how, and discussions were going on until maybe, for example, with the nurses and all, until it was announced for the PhD holders and doctors, then it took another turn. So the things we were discussing, for example, at that time with the nurses changed, and they increased the scope and all. And then that's how the strike came in. And then now we are having another strike. But it's all been part of the plan to see how to improve the lot of the people who are always in front fighting, especially during the COVID. They are always the forefront, risking their lives. So I think it's something we all agree that the health staff deserve. But going forward, after all these discussions, I know after this was issued, the letter, Minister, for example, the Honorable Minister was not, because it's going to really affect the services more. We were thinking of how we can convince the PSC to turn it into maybe a warning letter so that they can continue to work. Myself and PS, I've gone to meet the PMO Permanent Secretary to discuss in detail how this is really going to affect our targets if they continue with the course. So as a ministry, we think that we are sort of working with the either PMO and PSC to see how it could be maybe rescinded or turned into a warning letter so that the work can continue. But regarding contingencies, like you ask, what can be done? Because we don't have the ultimate power to change this. We can only request an appeal to PSC, like we've done. And then we continue to engage. And we are continuing that engagement, and all of us can be part of that engagement. And the senior members of the public health, we've been in discussion with some of them, and they are also using any means they have regarding the engagement so that this could be rescinded. But meanwhile, when that is not done, we cannot sit down and watch the population to suffer. So we are working on contingencies to see that maybe the most important, we may not be able to take over the whole responsibility that these staff were doing, but we look at the most important ones and try to see how a group of people are trained to take up that. Like, for example, the routine immunization is being affected. So as of now, we've identified a list of staff in each of the regions that we want to train quickly if this is not rescinded, and then they can maybe handle the for until, because 2 weeks is already gone, so it's just left with about 8 weeks. No, maybe 4 weeks plus 2, 6, 7 weeks, so that they can handle that until that is on. But other projects are not going on very well, like the response, the COVID-19 vaccination. We wanted to be doing campaigns now. We may not be able to do that. We needed to be doing some other campaign. And really, if we have it committed to something else, at least for this first time, because this is the first time it's happening, and I think a consensus could be reached to say that, this is the first time it's happening. Maybe it can be commuted into a warning letter or something, so that they can go back to work. Thank you.
Thank you very much, Director. Definitely, if Assembly can do anything possible to make sure that these services continue to be done, definitely we'll do it. Because as you said, services are affected, and once you mention it before honorable members, everybody is concerned. Because if you see why we are here, it's because of the people. So those people, if they are affected in one way or the other, definitely will be concerned. And then, as you said, PMO, PS, and we've taken note. If they need be, we will engage them to see what we can do with them too. Definitely. Thank you very much. If there is any other among the team, you can come in. That suffices then. That's okay. That's fine. Thank you very much, PS and team. Thank you very much, DPS and Director. Now, honorable members, I think you've heard them. You've had their submission. And then, as we heard from the Public Health Officers Association yesterday too, we can correlate these two things. And if there is anything that we need to set more light on, if you have questions to the PS and team, maybe comment or recommendation, the floor is open. Yes, Honorable Cisse.
Okay, I can come back. It's on? My test, okay. Yeah, like I was saying, I said, in as much as personally I don't encourage strikes, especially dealing with, the lives of the people, and that's the public health officers. But also in my own personal view, it is also not in the best interest of the people for almost 371 health officers, public health officers, to be suspended, leaving service delivery for the people just like that. I think that is a decision taken by PMO, like you said. One, I understand it is not business as usual, but also there should be a thorough study on the issue before the decision is taken, because like the director said, it's really affecting the service delivery, health service delivery in the country. So one thing I wanted to say, or I wanted to ask, is what really brought all these issues for us is the issue of initiating the allowances for nurses and doctors. And our interaction with the public health officers, they have highlighted that you have different cadres. If you initiate to have allowances for staffs within the ministry, it would have been important for the ministry to take a holistic approach to at least look at, different cadres and then create allowances for various staffs within the ministry. That would have been the best approach, and that did not happen. So now we are at a stalemate. The public health officers are going back and forth with the ministry, and they have taken decision that they're going strike, now being suspended. I wanted to ask, personally, who initiated the issue of, creating allowances for nurses and doctors to an extent that has been approved without the other cadre in the ministry? Thank you.
Yes. Yes. Can I come? Yes. Thank you so much, Honorable Chair, for giving me the opportunity. And once again, let me also seize this opportunity to thank the Permanent Secretary and his team, and to welcome you all once again to the National Assembly. Yeah, I just want to ask this question, PS, because I don't want to make any preamble, which has already been said by the Honorable Member for Olyundum. When the suspension was given to this cadre of the public health workers, 371, I just want to know whether suspension came because they have exceeded the 21 days as it was said by you during your submission, or suspension was done because they have said something during their communication to the ministry which really, was not, doesn't go down well with the ministry, because they said that when they requested for the rescinding of this suspension, the ministry told them that they have to apologize. The ministry told them that they have to apologize to them before they approach the office of PMO to rescind the decision of suspension. So, that's the reason why I want to know why the suspension. Is it because they have exceeded the 21 days, or they have said something during their communication to the ministry or to the office of the Secretary General that really doesn't go down well with the ministry and that of the office of Secretary General? That was the reason of suspension, and why, you have after requesting them to write a written apology to you, and which they did, yesterday the suspension is rescinded. That's what I want to know.
This mic is...
Okay, thank you very much, honorable members. To start with the last question, and then I'll come to the first one, as to whether the suspension is because they have violated, they have exceeded 21 days, or is because they have said something that warrants the suspension. I would say the suspension is not by the Ministry of Health. It came from the Personnel Management Office. And the only time that they could have suspended, they could have considered a disciplinary measure, is when the law is broken. And so it was clear to everybody that the sit-down strike of more than legally required, allowable, is in fact in violation of the law, and that is why the duty bearers, the overseers of that law, will have to apply that law, even though the ministry at its own level was doing everything possible, engaging them through the various mechanisms and the channels that we have used. We are on record to have used series of engagements and channels to reach out to them, and in fact accepting all the utterances that were coming out from their executive, which were mostly written, and they are there on record. None of it influenced any drastic move from the ministry. In fact, we were, even after those utterances, we were out and about engaging them, appealing to them still. So it could not have been statements uttered that would have warranted our anger to take measures against them. No, it was because they were openly in violation of the rules books, of the rule books. That was why those who felt duty bound, and if they have not acted, it would have, the law would have come hunting them. They had to take that appropriate step at that material time. Now, the other question as to what brought about the issue of paying allowances to nurses. I had said in my statement that it was the minister's own initiative to see to the general improvement of the welfare of the general staff body, not singling out one cadre, leaving out the other. However, knowing that it had financial undertones which did not lie within the mandate of the ministry, other stakeholders had to be engaged and they had to work out what is feasible. So it was planned to be implemented in phases. It was planned to be implemented in phases. At that material time, the issue of the on-call allowance for nurses had been a long-standing challenge at the time. And both the ministry and the personnel management office were considering to work on that. And so, if anything, that was why probably the first phase had to cover the nurses. However, you would also note that the issue of the doctors, when it came up, there was a public outcry. And what happened? It never got implemented. In fact, the ministry decided to even stop that. And to date, that is not implemented. But the misconception around the proposal of the allowances for doctors is that it was not targeted for doctors, because that was all inclusive. It was for PhD holders. And of course, it's not only doctors that attain PhD qualifications. If a public health officer got PhD qualification, he or she would be entitled, as there are examples already. All right? On the ground. So, to say that that allowance was specifically targeted at doctors was a misconception, and minister had been using public fora to shed light on that. It was all in the best interest of the general welfare of whoever would be entitled, and that can be across the board. That was the understanding. So it is not inspired based on that. And that, starting with the nurses, doesn't mean that you are eliminating the other cadres. No. And in fact, as soon as the payment of allowances for nurses began, work immediately started to compile the list for the other cadres. And this particular cadre probably is only the public and environmental health workers, are being serviced here, but the allowance that has been prepared is for all other cadres that were not included in the first phase. And that includes the laboratory staff, the lab technicians, the lab staff, as well as the pharmacists and the public and environmental health officers. So the allowance, in other words, is for those cadres that were not considered under the phase one. If we had been allowed to sail through to the tail end, the public and environmental health officers would have gotten allowances, including also the lab technicians as well as the pharmacists. So basically, that is the response I have for these two questions.
Let's keep one of your questions.
Yes, remind me about the other question.
Really the thing that
Okay.
the question is
Yes. Okay, yes, thank you very much for reminding me. Yes, and I had said in my earlier statement that we did not request them to apologize. We did not demand them to apologize. We did not demand them to apologize. We recommended to the mediating team that came to meet the ministry. The mediating team that was the they call them task force, but it comprises of veteran public health officers, retired public health officers who are around and had been interested in health still. In fact, some of them are supporting the ministry. So they felt they have also a role to play, and they just took up it on themselves to seek an audience with the ministry to come and engage. When they came, a fruitful meeting was held and a minute was written. And then in that meeting, they requested that we work on getting the decision rescinded. The ministry told them, well, it has gone beyond the ministry's level. So, in other words, the ministry leadership and all of you are on the same side. Now, together, we can work on approaching the PMO to consider rescinding this decision. But how do we approach PMO? We cannot just write to them and say, oh, we consider you, we want you to just rescind the decision. No. They wanted to see some level of a change of mind and some level of remorse. That's what we thought. That's what we envisaged anyway. So we recommended that, well, it would be good to go to PMO with something. And that something would be if we can have an apology letter written by them. Because even PMO and everybody had been listening to some of the statements that were coming, and they were also following how things were unfolding. I cannot speak for PMO, but for the ministry, I was saying that if it was going to be the unacceptable probably statements, utterances, we would have done that long time, because they had done a series of it, and in fact, they had conducted media interviews, which they are not mandated to do even. They have conducted it. We have allowed all that. They have written and sent us letters, and some of those letters, if you will provide you with all those correspondences, so that you see some of the statements that were coming. But that never influenced our move to take any drastic action. We were even after those ones, we were just following to appeal to engage them professionally through direct face-to-face meetings or using certain respected, personalities. We have a group of senior staff of the ministry, directors of the ministry, who also were in the background between us and them, talking to us, and we were talking to them, and they were going to talk to them. And anytime they requested to meet the minister doesn't delegate anybody. He himself would sit with them. Even in some of those meetings, they will say utterances that some people will not accept. But still, minister condone and still encourage us to write to them. I will give you one letter here that was written on the 22nd of June, 2022. And on the 21st of June, they had a meeting with the minister. I was not in that meeting, but it was an impromptu meeting they demanded, because they wanted to, they said they wanted to converge at their Congress to try to formulate a decision, to try to engage their members to see if they can decide to return to work or not. And then they requested a meeting with minister. And in the purpose of that meeting was for them to now say, okay, minister, we want to go back to see and engage our members to see whether we can get them back to a call of the strike. But we need a letter from you. We need a letter from you that will be comforting. And we had to write a letter. The following day, we had to write a letter and then give it to them. Just in acceptance of their demand that we write to them before they can engage their staff, their members, to consider. And in fact, that was to consider whether they can encourage their members to return to work. Even after the 28th June deadline had passed. This is what happened. So we gave them a letter, and upon receipt of that letter, they went and had a meeting. And come and see another letter they wrote, a statement they wrote to their members. Even when they were asking them, okay, we can go back to work next Monday. But then even the letter that they wrote, giving that instruction to their members, we will provide you that you see also.
That's fine, that's wise. Anyway, I just want to clarify one issue, because as a National Assembly Select Committee on Health, I was an integral member, I was a key member of the previous health committee, and the allowances for doctors precisely came up during our time. And then in fact, we've been accused of probably prioritizing doctors and so on. But I just want to make it very clear, this was a proposal that was brought by the minister. And then I personally, in the full of the parliament, if you can go through the record, I against it vehemently. But like when we went to budget bilateral, when the minister and team explained to the committee the rationale behind it, definitely we have no option but to accept it. Because this was not something which it's been sanctificational or whatever. Because the way he explained it, how PS put it here right now. And the committee stood by him and then supported him on that proposal, even at the floor of the House. Because he said this allowance is meant for doctors and PhD holders. I can be a PhD holder. Somebody else can also be a PhD holder, and so on and so forth. So these allowances, they are meant specifically for those categories of people who have excelled, who have done extremely well in terms of the academics to make sure they excel. So that was the misconception, and then even at the level, that is it, that's how it works. You don't
fulfillment of our obligation under the three drug conventions and the related regional and sub-regional arrangements and protocols.
Definitely,
the agency took part in conferences during which matters of great importance on the way forward to address the world drug problem we are discussing. Among these engagements include one second ordinary session of the African Union Specialized Technical Committee on Health, Population, and Drug Control, held in Addis Ababa. sub-regional discussion on cooperation against drug trafficking held in Dakar, Senegal. 27 Java Technical Commission and plenary meeting held in Monrovia, Liberia. And the 27 heads of National Drug Law Enforcement Agencies in Uganda, which was held in Egypt.
So I don't know
on
how
international cooperation. The fight against drug abuse and trafficking required concerted efforts of all stakeholders. Therefore, it is imperative to foster collaboration with both security and civil institutions that may be strategic to our operations locally and internationally. In this regard,
say that I was
agency collaborated with international organizations, agencies and institutions on areas such as capacity
and what transpired
joint
is that
operation. We also enjoy support from some diplomatic missions in the
officers to resume work.
Negotiations with our counterpart in Senegal for the signing of an operational memorandum of understanding was initiated
3 days before
by the agency with
that
technical support
that was held,
from the USDEA
and senior members in that meeting appealed.
Honorable Chair, on drug supply reduction during the period under review, the agency continued to intensify supply reduction
to re-engage
by post border sea and
delayed
the Gambia Police Force,
until the 28th.
Gambia Armed Forces, Gambia Prison Service, the Gambia Immigration Department, the Gambia Revenue Authority,
the
Gambia Civil Aviation Authority, and Gambia Fire and Rescue Services,
we had
Attorney General's Chambers and Ministry of Justice,
sent out
the Judiciary, Ministry of Health and Social Welfare,
to try to
Financial Intelligence Units, among many
they were
others,
telling us
on a wide range
they would
of
resume work
activities.
if we give them letters.
The officers of the Police Intervention Unit, Honorable Chair, were attached to the agency
So we were
to
observing
provide backup during operations.
knowing that they also knew that by
This
Friday
is necessitated by the hostilities
there
our
was no
men
action to go back
consistently
to work,
encounter during operations.
what was
To
requested
the extent
in
that
that
some
letter
of our
was
operatives suffered serious
that
injuries
the
from
list of
assault
those,
by
the names
suspects
of
using
those that
knives and other light weapons.
failed to report
Despite the efforts employed to control the flow of
that was made
drugs,
public.
dealers are still capitalizing on the
For
porous
administrative
borders to
action.
smuggle cannabis from Casamas
Then,
into the Gambia. And trend
when the
analysis
deadline
suggests that most of the dealers entered through
No
villages
action
like Shibano,
was communicated to the ministry to say,
Jalokoto,
so and
etc.
so
in the
people
West
have
Coast
reported
region.
to work. So and so
As
people
evident
have
in the
reported.
statistics, cannabis is still the
And
main
it
drug
was a
problem for the
requirement
Gambia.
by formal communication.
This drug constitutes
So,
highest percentages of
respective
all
heads of
illicit drugs
institutions,
seized in
The
2017.
respective directors of the
The
region
reason is attributed to the widespread cultivation
It
of
was a
cannabis in
task
the
for them
southern Senegal province of Casamas, which shares a long border
comply
with the
with that
Gambia.
decision and to make sure they
Honorable
fulfill
Chair,
that
the
part.
statistics
You observe, you
revealed
staff.
an increase in cannabis
Either you
and
encourage them
heroin
before the
seizure
deadline,
compared to
you encourage them to
2016.
come to work.
However,
Knowing that
seizure
we
of
have told
cocaine
you
and
that
other
if they
prohibited
don't
and
follow-
controlled drugs
return to work,
decreased.
by that date,
Methamphetamine and some
names will
controlled
be
drugs
written
were
down of
also
those who are
seized
absent.
during the period.
So we followed, and then
A total
we
number of
reminded
425 cases were registered,
with emails
within
and
468
calls to all the
persons
regional heads and the heads that
of
that
different
are responsible
nationalities.
for
This
them to
number
respond.
suggests an upward trend in
They
arrests
ignored the
compared
letters
to
written by the permanent
275 cases in 2016.
And even
The number of
everybody
young people
who
involved in drug abuse
ignored,
and trafficking saw a
and they
disturbing
ignored
trend
the emails
as
from-
minors are being arrested
issued by
with
the
illicit drugs representing
Director of Human
6.41%.
Resources, reminding them
The large number
that
of persons arrested with
please
drugs falls
tell
within the
us
youth category,
whether your people have resumed work.
representing 57%.
If they have not, tell us
whilst
who have
adults
not
represent
resumed.
35.68%.
Now,
Records show an increase in female involvement in drug
we got
crimes from 5 in 2016
permanent
to
from
8
the
in
PMO
2017.
that they are expecting
Much of the
that
drugs seized from Gambian
we
women and
should
minors
submit
is
them a
cannabis.
list. We did not just jump and
Gambians
pick any
constitute the
list.
majority of persons arrested for
We have a
cannabis
database,
possession
of
and
course. We have a
trafficking.
database.
This merely
And our
reflects
HR department
the fact that
is
the majority
the
of
department in
people
charge of the
resident in the
personnel.
country are Gambians and not necessarily
use that
suggesting
means
that Gambians
and
are more
engage the
criminally
regions.
involved in drugs.
And then knew
seizure of hard and controlled drugs involved mainly
was not at work at the
nationals.
time. We realized none of them were
During
at
the
work.
period, the following
Now, if
quantity
they
of
say
drugs were seized.
there are elements, there are some
The agency seized
who are
2
on study leave,
tons,
I could agree to that.
563
It's
kilos,
possible,
213
because
grams,
we could not fall back to
460
every file to know who is on study
cocaine,
leave at the time or not.
624
All right?
grams, 748 milligrams.
What our
Heroin,
database
34 grams, 800 milligrams.
is
And
what we
hashish,
really
1 kilo,
went by.
237
And
grams,
upon extracting
243
it,
milligrams.
we had to
And
consult
126
close our eyes
controlled
and
drugs
pick the
comprising
payroll,
pronazepam,
it would include other
clonazepam,
carriers
diazepam, and
other carrier staff
lorazepam were seized.
who should not have been affected.
While methamphetamine,
Is it?
298
It could have
grams and 90
included even
milligrams
nurses
of
who are
methamphetamine
on
was equally
public.
seized.
But none of those carriers
On
were
prostitution, Honorable
included.
Chair,
Now, if
Honorable
you say you are on study leave, give us the evidence.
during the
That's what we
period
call
under
it.
review,
Give us the evidence.
5
And you will
specialized
know
narcotic courts
that
were
I'm not
operational.
saying that the
Within
people have experiences that people
these
will
courts
choose to go
determined
on
a total of
self-imposed study leave
130
sometimes.
cases.
So if
out
somebody
of
is on
which
study leave,
107 cases
we
were
told them that
convictions.
if you give us evidence
22
that
acquittals.
you are on work,
And
you are
one
on
was
duty
disease.
on that particular day,
3 out of
and
these
you show
cases
us
was prosecuted by the Office
attendances
of the
that you have
Director of
signed, you
Public
show
Prosecution.
us evidences that you are at work.
Honorable Chair,
We
honorable
rectify
members,
it, we
on
go
drug
back.
demand reduction,
But to date, I have not
during the
received
period under
any
review,
single letter on my
various
table to
media
say
activities
this is
were
the evidence that
undertaken
so and
as
so person
discussed
is on study
below.
leave, so and so person is was at work on that day. If they have it, I told them, if they have it, let them bring it forward. But they have not come forward.
Thank you very much. Yes. Thank you very much. It's very interesting. Members want to come in. I mean, I have more questions, but I think the priority is the members to come in. You want to come in or by you can answer it right, please, Darren. You can follow it up. You can use the mic, please.
Okay.
Use your daughter.
Thank you very much,
If anybody want to come in, please.
Honorable Chair.
Okay.
And thank you very much, PS. Like I told the team yesterday from the Public Health Service, that I commend them for at least widening our horizon in terms of understanding what really happened during the process. I will also repeat the same thing on your side, because in any situation where two partners are involved, you must hear from both sides to be able to come with a conclusion, and a tangible one for that matter. But the Honorable Chair of this committee have asked a very important question. And I believe, for me, it doesn't make sense if they said that some of these members are on study leave. Some of them, even to us, during our tour, that is our 1 week tour that we did about 2 weeks ago, we met some of them on the ground. And when we asked them, they said our names are part of the list when they were on duty. And the PS is here saying that he haven't received, that is what he said, he haven't received any formal communication. I will go back to what I said yesterday. There is communication gap, and I believe it is important for us to work as far as this communication gap is concerned. Because if both parties are not exhausting all protocols, there is something happening. But notwithstanding, I will also want to remind the PS and team that we are at a very complicated situation, because we are all at risk. We are all at risk. That is why we, the Parliament, like the Honorable Chair have said, it is not our mandate to tell you what to do. But when it comes to the services that is to be delivered to our people, it is indeed our concern, and we have to involve or engage the relevant authorities, which we are currently doing with you people. So, considering what they said, that has to do with some of them going for study leave and being included on the list, I think it is also important, professionally as a team, to work with your HR department and see how best you can regulate the system. Because I believe, as far as the data is concerned at the ministry, you should have people, you should have on your data that some of these people are on leave. Some of them are no more part of the system. That is what we are expecting from you. But you cannot also tell us that you didn't have the time, because listening to you, that is what you said. You didn't have the time. That is why you submitted a list to PMO. So I think you really have to tell us what really happened, please.
Thank you very much, Honorable. And please, you can take note of, or if you want to respond, you can use to. Yes, for other honorable members also.
Yes, thank you very much, Honorable, for that comment. I think your concern is noted, and really, as I said, it is not in anybody's interest, including the Ministry of Health, to go through this experience. However, one clarification I want to make is that I did not say that I don't have time. I said we have engaged actually, and we have done our due diligence really on the list, because I was central to its production. So what I said was that if you said you are on study leave, at that material time that we were to produce, there was formal communication, circulated, and it was no secret to anybody that this was going to happen on so and so day, and a list was expected from the respective units. If a list had come of those that are on duty, we would have spared them. But until now, I personally am not convinced that those claiming that they are on study leave are really on study leave, because I have seen no evidence, not from my database, not from their side. So if my database cannot show it, they have evidence. They have not come forward with it. That is it. Thank you.
Thank you very much. Yes, thank you very much. I think the department help us to get my just but I'll invite you on the floor. But before you come in, I think as a committee, after we have to maybe sit for maybe some time and see what we can do. Thank you.
Thank you, Chair. Okay. Good morning, Chair. Good morning, Mr. PS and the team. And thank you for the clarity of your explanations. I would start with a remark before I pose my questions, and then I think I'd like to join the honorable colleagues to look at how to solve some problems. We look at the genesis, the origin, and then I think the origin started from when the initiative was conceived, when it was a laudable one, with the minister to see how to upgrade the allowances of doctors and nurses. But when it becomes a differential treatment, that will be another problem. And that's where we are now. Because I think, like they've said, ministry comprised of different cadres. Now, if you are trying to upgrade their living conditions, their job conditions, you look at it technically, not to afflict any of them. Anyone who is entitled to it must have it. I was thinking, like, to start with the doctors and nurses is not bad, but you look at your cadres. Why not start also with the lower rank? Why not also include the lower rank? Why not also include their cadre at all? You cannot start an upgrading system and start with one cadre and you should look how to affect impact on all of them. You cannot say first phase is this one phase. That's the differential treatment. Since you are giving priority to one over the other. And this is where the problem started. Now, another differential treatment with regards to this thing is like we've experienced doctors go on strike here. Nurses went on strike here. They were all managed successfully, and I thank you for that, your ministry. But why is this one different? Are you telling Gambians that these people are the least important in this cadre? Of course, that is this message that is put across. Because if doctors went on strike, we know how important their services to the community. No one is telling them they should look at the service they have, but they also have a life. They have the right to how to sustain themselves and their families. They have a right over the ministry to look at their welfare. So no one can blame the person striking for not looking at the welfare of the citizenry. Who is going to look into his welfare then? If you are not looking at his own welfare, he has right to demand for his welfare. The doctors did so. The ministry played a very pivotal role and did what it's supposed to do without any suspension. The nurses did so. The ministry did what it's supposed to do without any suspension. Why is this one different? Why? That is, in fact, that's what going to aggravate their anger. And then we are not competent or capable to manage their anger, to manage their frustration. We add salt to injury.
Correct.
We are adding salt to injury. Because if you say they are not sensitive to the plight of the Gambians by going to strike, and when you came to give another suspension of 4 months, are you also considering the plight of Gambians? Leaving 371 people out of work, who is going to render that service in their place? So if you are saying they are not considering the plight of Gambians, then the Parliament also was not considering the plight of Gambians. Because the doors of dialogue are never closed. They are never closed. They are never closed. They should exhaust all means, especially when anytime you call them, they answer. And they explained yesterday that sometimes they even call and they came, they were made to sit in the afternoon, go tomorrow. No, you are not part of this meeting. They are always available. So there is no point. I don't see the meaning of this decision. I was alarmed when I heard about it. But then listening from the PS that the issue generated from the PMO, I was kind of relieved that the ministry who should look after the welfare of its staff is not actually the one that generated the suspension. I was a bit relieved. Now, the PMO, if they acted without consulting me with regard to the suspension, they are not fair to the ministry. Because in the action, you must assess the damage. So the ministry that is responsible to provide those services, you cannot sit at PMO and suspend 371 staff without consulting the ministry and know what damage will it cause. So that was a technical blunder. Now, but then when I listening to PS also telling me that you have sent a letter to ask them to come to work within this particular day. If they don't come, you will ask their names to be collected and there will be administrative action. And then I kind of correlate, this is what entertains the action that comes from PMO. Because PMO is, in the letter they said they approved suspension. So who recommend to them? Their letter, they are saying we approved. Who recommend to them? So if PS is telling me you sent a letter to warn them that if you don't come, we are going to take the list and administrative action is going to take place, and then PMO just comment. So there is connection somehow. But I'm not convinced. You understand? So I think the best method is not this suspension. No one wants anyone to go on on strike. It's not the best option for anyone. But then when people are on strike, we have to look at how to solve it amicably. And then even in the letter from the PMO, they did not cite any provision or any law that these people have contravened. You said 21. It's news to me, but their letter did not indicate it. And then if somebody is on strike and is flouts the law, you should indicate this provision, you contravene this provision, and these are the penalties. And I don't think those who make those provisions, the first penalty should be suspension. There must be a warning letter. So the procedures, you cannot be the breakers of the laws. You know, so definitely there must be a solution. And then, I know, the difficulty comes with you. Because the ministry, you are going to feel the burden. Your 371 staff are at home, and then the demand of services, you are going to feel the burden now. We know that. We know your frustrations. You know, it's going to be difficult, but then this is not the... Then my question is... Sorry, Chair, let me come to my questions now. Yes. According to them yesterday, they have in fact agreed with negotiations, whether it was you or this thing, that they should go back to services. They should go back to work. But 2 days later, this suspension came. I was surprised to hear that, but if that is right, can you talk on that again? You understand? So also the Chief of Staff, we saw a letter communique from the Chief of Staff to your ministry that the agreement with them was in March or so to pay their youth. They have agreed, because these people have gone beyond you up to President's office, and the President's office discussed with them and agreed. And now there is a letter coming from them to you that we have agreed the letter was June 2nd. Now they have agreed that this allowance should be paid, and in May, and it has not been paid. The letter is reminding you to do that. Why was this instruction not honored? You understand? Yes, the issue of these allowances, because we've heard from them. Can you specify, if you have agreed with them, what are exactly these allowances we are talking about? Thank you.
Thank you very much, Honorable. That was, you lay the foundation and then you come with the questions, right? Thank you very much. That was a little experience. Stop your mind. But anyway, yes, Honorable, you want to comment? Or yeah. Yes, I hope that you know. Please, if you are not comfortable with that, you can answer.
Okay, yes. Thank you so much. I have heard you loud and clear. I can say we all, the Committee of Health, have heard you loud and clear since yesterday when these people came, public health officers, and today you are here again. According to you, you say the dialogue started since 2021. The dialogue of these allowances, it started since 2021. Doesn't mean that these people were not receiving their allowances since 2021 up to today. And releasing the suspension letter, I think it's just like putting salt into the injury. That one doesn't solve any problem. You need to talk about that and remove this stopping of their salaries for 2 months, like suspending them. The sit-down strike have been happening from the doctors to the nurses, and you solve the problem. Why that public health, you venture into suspending them without solving the problem? And this is affecting all the consequences of the Gambia, because I can recall the people of Foni Belfast even call and say that the public health officers say that they will not attend to us because they are on sit-down strike. This is affecting everybody because of what the allowance. And the problem here is based on the allowances only, I think. Why can't you give them what they request? Give them the allowance, or you discuss with them for them to know what to do. Or you people tell them, these are the people who should receive the allowance, or these are the people who should not receive the allowance. Rather than suspending 371 youths of the country, sitting down without doing anything. What are they going to do next?
Thank you very much. Can you please come closer? Huh?
Yes, thank you so much once again, the peers and the team. And then we thank you so much for taking your time honoring our invitation, at least to come here, having an interface with you people so that we can know actually what has happened. And then, as the Vice Chair said, that when two parties are at loggerheads, you need to listen to both sides before you make any judgment. Otherwise, if you want to listen to one side, you might be biased in your judgment. But for me, I just want to put one thing across, that is health workers, they are the people, under any circumstances, no health workers should go on strike. Because health workers, like if you are working, maybe you might be expecting a higher pay, even if you are not highly paid. But in the hereafter, God will reward you again because of the good work that you are doing and by helping your people. Like, to my understanding, I want to believe that there is a communication breakdown between PMO and Ministry of Health. Because as other speakers have alluded, before you go up to an extent of suspending 371 public health officers, I think what the PMO could have done is, and then they should have served them a warning letter before going for suspension. And also into consideration that Gambia is a democratic state, and then whatever we are doing, it has to be in line with our constitution, and then it has to be in line with zero, that is the government order. And I want to believe, as the press have mentioned, like if you stay away from work for more than 21 days, the PMO have that audacity to stop your salary, and then they have money to suspend you. Like we are here just to solve the problem as the Committee for Health. So now, for me personally, the appeal that I want to make is for them to rescind the suspension might be very, very difficult, because this thing has gone viral, and then governments are following as the situation unfolds. But notwithstanding, what we can do as parties, I think, for me personally, I am just appealing to the PMO and the Minister of Health so that they can just come together so that we can see how to reduce the suspension, so that these public health officers can go, they can resume work. Like, that's my take. Because otherwise the services will be suffered. Now people are in the provinces or even in the urban settings without taking their immunizations, and then a lot of things is happening around the world, and then the work of the public health officers are very, very important. And I think this is a food for thought for Minister of Health, especially the Minister himself, who has a very, very, very good heart for health workers in this country. Like what he wanted to initiate, like he wants every health worker in this country to benefit this package. And then, but unfortunately, things fall apart, but it can be fixed. Like yesterday when they came here, personally I asked them, you are talking about allowances. What allowances are these? So according to them, they said they were paid for the RICS allowances, but that RICS allowances has been reduced. I said, why? They said they don't know. And also they said on-call allowances, responsibility allowances, and specialty allowances. I think these are the 4 allowances that they were talking about. But personally, what I told them yesterday is all public health officers should be paid RICS allowances, no matter what happened. And then reducing their RICS allowances, I don't know what is the rationale behind. But these other allowances, I asked them, is it that you're talking about the entire public health officers? Because if you say on-call allowances, responsibility allowances, what I think as responsibility allowances is, I think that one should be assigned to only desk officers. But you cannot tell us that all public health officers should be paid responsibility allowances. For me, it doesn't make sense. And on-call allowances, even cite an example by telling them, like for us, like on-call allowances, most of the time, what I know is the doctors, and then also the officer in charges, like health facilities or hospitals. Those are the people who are paid on those allowances. And specialty allowances, That one is there for people with special skills, like a doctor who is performing surgery, like any other public health officer. Like I said, these are some of the allowances that should be paid. But if you said this for category of allowances should be paid to public health officers across, I told them categorically that is not fair and that cannot happen. But thank God their president said now there are specific people within the public health who should be paid these allowances. So, like in a nutshell, before to do the cutting down, what I want here, I want the Minister of Health to engage PMO, because as other speakers said, before they go for suspension, they should have informed you people. Well, anyway, we know what is happening, but this is what we want to take as our stand. Then from there, the Ministry of Health will also give them advice before suspending. And then, you know, those health workers who are suspended, those who are working at the PMO office will not do their work. So this is my take. So thank you very much, Piers and the team, once again for coming here.
Thank you very much. I think we will another party like the case now to explore the issues by the Honorable Baji, Honorable Kwali, and Honorable Bora. Thank you.
Yes, thank you very much for these questions. I think it's a lot of questions. I will attempt to address them, and if there is any question I forget, you know, any of my team that picks it can come in, or maybe you can remind me. First, about why the suspension for this cadre and not nurses who had been demonstrating, or and doctors. My simple answer would be, this is the first time that there is this hard deadlock in negotiations, which we never experienced with the other cadres. There is a complete deadlock. I would describe it at this juncture. That was why it has reached its maximum level of negotiation. And every sign we had seen is that unless we condone to be in violation of the law, together with them, there is no solution, because the solution is that they accept to allow the due process to reach its tail end. And they were not ready to do that. We had told them that we are going through a process, and every stage of this process is made known to them, and in fact they were involved. The reason why the office of the president had to be involved is because they created the impression that the ministry is not on their side, that the ministry is working against them, that the ministry is not interested in their welfare. So even at odds with official procedures, they had to write directly to the office of the president, to State House. Is that correct? You have a land ministry, you want to bypass them and communicate direct to the office, but still the government accepted it, thinking at that level they will be able to do what we are unable to do with them. They gave them their words, they gave them their appeal, and it didn't work. It didn't work. Otherwise, they would have called off any attempted strike when they receive a letter from the office of the president that we have instructed for a payment to take place. But we realize that these monies are not budgeted. And so we have to allow the budget process to take place. There is a key stakeholder, which is Ministry of Finance. They have to advise us on the source of funding, the available source of funding for this. And if there are any legislative requirements, you have to allow us to go through that through the National Assembly. If I am interested in having a solution, that is enough to convince me that will be enough to convince me. I ignore my minister, who has been day in, day out appealing. And then the matter was taken over by the highest authority in this land, Secretary General, who was entertaining you in his office in lengthy meetings, listening to you anyhow, writing to you officially. If it were me, whatever I have, I will rest my case and return to work. This was done exhaustively, and evidences are all over the place. But, so that is why at this juncture, well, the ministry is helpless that we have to reach this level. If we had all heeded, it would not have reached this level. But now that the decision has been taken by an authority which the ministry don't have control over, well, it is also our responsibility to join the mediating process, to do our bit to be able to see how we can get a change of mind from PMO. And that's why we demonstrated with the letter that we wrote to them recommending the rescindment of the decision. Now, you said they were suspended 2 days, 2 days after they have decided to go to work. But there was a deadline of Friday. We had a meeting on Wednesday. There was an appeal that, and the decision was going to be taken on Wednesday. And there was an appeal that we give them time to engage them on Thursday. And that the impression was on Thursday, they were going to call off the strike, and by Friday, they will go back to work. They met and decided that Friday they cannot go to work. They will push it to next Monday. If I am interested in calling off any strike, immediately I have made a decision on Thursday that I'm going back to work. I wouldn't want to wait an hour not to go back to work. Why push it to Monday? And even though you have, that makes sense. So these are some of the things. PMO did not quote a provision. Probably they know how their style of writing letters. Maybe they didn't quote it, but they have clearly indicated that it was in violation of all appeals and rules. Since the other question says, since 2021, is it that they have not been paid allowances? Honorable member, let me tell you that there are a series of allowances, and this particular allowances being requested comprises of risk allowance, specialty allowance, and responsibility allowance. But the other allowances are across the board. Risk allowance is across the board. All right. If they say they have got a reduction in risk allowance, well, PMO can explain that. But what we know is that PMO has adjusted all risk allowances by up to 2,000 across the board for all healthcare workers. And that is what is being implemented. All right. Now, if you are receiving a risk allowance, maybe plus another allowance by virtue of your location, and the coming in of a high risk allowance suppress one other allowance that we are enjoying, which looks similar to risk allowance, obviously you expect to go down a little bit. But it is supposed to be made up in another way. And PMO had done their calculations on that. So 2,000 is being paid across the board. If it is not, then it is only a question of probably administrative irregularities that need to be taken care of. Why suspend without a solution? Well, as I said, we have come to a point, it was a deadlock, because we knew we cannot pay without getting the finances, which was not in budget, and we had to go to National Assembly to get it, and this was communicated to them. So if they realize this as a genuine excuse, a genuine explanation, as a patriotic citizen, I see no reason why I should press on, continue with the strike. Now, and remind you, the country has suffered for more than 20 days before the suspension. The suspension came in, all right, only maybe to prolong it a little bit, but have we forgotten about the 20 days period that we are not showing up in services because they were on strike? So it's sending. So the country have allowed for the citizens to suffer for 20 days. And mind you, the public was standing by, watching the ministry take this matter up with the staff as if it only concerns the two of us. Now it's a bigger problem, so people begin to realize that they need to come in. But it is an intervention coming almost late. We had been advocating for people to join us. We have held press conferences appealing. And we have had meetings calling on other stakeholders to join us and talk to them, even family members.
Yes, can I just interject on that one? As far as we are concerned.
Well, I'm sorry if that is out of context. I'm very sorry. I'm very sorry. Yeah.
We have never received from the ministry, rather from the political association, that so and so is happening. We are just in the media.
Yes.
And that is it. But any official engagement as far as this matter is concerned, the first time we did that was when we had the briefing.
Exactly.
And it came up as an AOB.
Okay, that is out of context. Sorry about that. So now what I can say is that we are here to look for a solution, and the ministry, without waiting for anybody, was diligently working on. But we believe as a ministry that we are having a serious difficulty in getting our message across to our members. We believe it's not warranted. We believe we could have they could have understood our position. We believe they could have seen our passion. We believe they could have at least, seen the messages we were communicating through our formal letters, for them to know the challenge that we have as a ministry. The challenge that we have as a ministry is that we need to convince other stakeholders, and we have been able to successfully do that to the point of getting cabinet's approval for these allowances to be paid. And we have seen correspondence that came from the Chief of Staff instructing Ministry of Finance to pay. But the ministry realized that it was not budgeted, that it had to go through another process to go through the National Assembly to be able to get it done. I think if that is made known to them, for me, they could have understood, and then we could have rested this matter, and everybody go back to normal and everything resolved. So that is our. But Dr. Bite, maybe you want to comment.
You want to comment? I think from the after you can handle it. Yes, you can carry on after you can handle it. Or if you want, I have no problem. Honorable.
Yeah, thank you, Honorable. Thank you, Honorable Baji. This is just a little clarification on a very important issue Honorable Baji raised. So I think it's a perception maybe in the public, and that's what Honorable was referring to. But I can assure you there is no differential treatment. Because what happens is that there are two things that we are working together. And the first one was actually for the whole team. I was involved, we were all involved. When Minister wanted to work on the allowances for all the cadres, nurses, public health, but that was supposed to go to cabinet. Then there is a group of people, about 8, that I have the numbers. I think you have that concept note. 8 of them, I think, 8 or 7. 2 were nurses with PhD, 1 was a laboratory science, 2 public health officers and 3 doctors. So it was not going to be only doctors. These are special cadre, which, for example, if you have a nurse with PhD moving from the university because of his quality, if he moves to the ministry, there is a big drop of his salary. If you have a very capable doctor at the hospital or at the university and is moving to the ministry, you'll get like 25% of your salary compared to what you used to get. So the ministry, there was no increment inside. It was trying to say that for that group of people, let them even go near what they used to have or have, but not 25%, or at most equated. So this was not like it was going to affect a big, there is never a time when the ministry came to say that they wanted to increase the salary of doctors. It has not happened. It was for this group of special people. And when the concept notes was written, it was around 7 or 8 people that were affected to bring their salary to look like what they will be having if they move from that facility to this facility. So the differential thing, like the minister always says, and we always say, we are a team. If you are a coach of a team and we support only your defenders, you leave your strikers, you will never win. And as us ministry, we are assessed based on the targets that we achieve. We are not assessed based on how we treat our people. When we come here, it is what we were able to achieve. Right now, because of these strikes, our targets will go down. And when we come to answer here, you will be blasting us. So it is not to our interest that we have members of our staff not happy, not interested. So that's why the minister and all of us, we are working towards increasing the lots of everyone. But these methods are different. For this group, it was supposed to go to Parliament and is more rigorous, and justice has done it, so we wanted to use similar method. But for the other people, everyone else, it was going on in the background, and it started first. And that was to go through cabinet, convince finance, get the resources, which was huge. Because this affected only 7 or 8 people. But the other one was huge, and you need to raise the funds. And minister had already even raised a lot of the funds. So I just wanted to say that there is no calculated differential treatment amongst our staff and cadre. So the other thing is, I think there is also a new dispensation. And I think things are not as before, because we had to defend a lot of things. Because we have a new ministry that is responsible for civil service, and I think they are looking like, just like here now, the cabinet here, it's quite different. Before, we don't do all this swearing and all. You could see there's a new dispensation. And anyone who comes, usually, you want to follow the rules as much as possible. And I think that is what is happening. But it's not a targeted group that we are targeting, please. Thank you.
Just another one that according to Honorable said, the case of the notices, because as far as we are concerned, I was part of the previous committee and I'm part of this committee, but that is to never come before the National Assembly Committee on Health. And then I think the notices were engaged on strike. They were sorted, and then these people are referencing their issue on that. But we don't know, we are not privy to how it happened. So probably you can set light on how it happened until everything was. That will definitely happen.
I was just coming in to add on to the voices that yes, allowances, if given, it should be holistic. We are a tax-based country, we all know, and resources are limited. If resources are limited, let's give the lower cadre first, and gradually we moved on to. But what is missing in this whole discussions is the issue of the code of conduct. We are civil servants. We are guided by rules and regulations. We have the code of conduct, we have the code of ethics, and we have also oath of professions that we must respect for the good of the citizens. And the most important part of it all is that allowances are privileges. If my salary was stopped, certainly salary of any cadre, you can strike. But allowances are privileges. Inasmuch it will motivate staff to do more. So in this discussion, we should look at it in a holistic manner and address it in that way. And also, we also think about those who are poor and needy and need our services. That brings the oath of ethics, especially the oath of profession. Thank you.
Thank you very much, Madam. Maybe I can say more on this, or maybe PS, whosoever is more comfortable, because it will definitely help me over other members. How the case of the nurses was.
Okay. Yes. Well, in my perception, the nurses issue came at a time when funds were available. Because what happened was that at the material time, there were COVID funds that were available. And as we speak, from records, we have paid allowances totaling 110 million from the COVID fund to frontline health workers, which include these striking members and all other cadres. These particular allowances being claimed are, in other words, additional. They are additional that we thought would be, an additional motivation, because the frontline worker allowances was, in recognition of efforts done in the COVID response. At that time, before those funds were exhausted, that was when the nurses issue came up. And the fact that OP was also involved in that negotiation, and it was at a crucial time also, then we had an avenue to tap from. But this particular time, that avenue is not there. We realized we had to rely on the budget to be able to do that, and to be able to get the budget accept this. And for on an annual basis, we are talking about nothing less than $53 million in total that was to be paid for this eligible group, for this category of allowances for the year. Now, the budget cycle is long over. How can we get 53 million put onto that budget without resorting to a revised budget, without resorting to National Assembly for an SAP? I think this is what the Ministry of Finance has been telling us along the way, that these funds are not available. And in fact, if we just should go ahead to implement it as demanded, it would be extra budgetary and it will be it will have legal implications. So we had to allow the process to go through. So the short answer is that the nurses' own came in and it was smooth, because at the time the COVID funds were not exhausted. But this time around, and if you compare the magnitudes, it's different. So basically, this is the answer to that question.
Okay, thank you very much, PS. Thank you very much. I had you. And that was a supplementary question, but regarding the issue of the nurses. But it also have brought up another issue, because he said the strike came when there were COVID fund and they were paid using the COVID fund. So I don't know how it is being sustained now. The nurses allowances that is being paid, how is it being sustained? Because I think you said there were COVID fund that you used at that time, or was it a one-off payment, or they are still receiving it monthly, those allowances that they were claiming until they were engaged on strike?
Now, you realize even the nurses one was not before cabinet approved. It wasn't before cabinet approved. And the initial months towards the end of the year was paid through the COVID fund. However, at the beginning of that year, at the beginning of 2022, because that magnitude had been known at the time, it was captured. It was captured in the budget. But when the issue of this other cadre came in, you realize also that the budget cycle for that year was also done at an early time, when we had not even completed that of the nurses and then start with the second phase. So that is basically the explanation.
My apologies. My apologies. My apologies. I apologize. I think we did not give him the opportunity because you all once had the opportunity. Do you have a question or a comment? Yes, you can comment, then you pass it on, Honorable Jack.
Before you pass the mic to him, I can ask a follow-up question.
You know, there you come. Thank you so much. P.S. I mean, Honorable Chair, with your permission, I just wanted to state this. Now we have heard from the public and environmental health officers, and then we've heard from the ministry as well. Our role as an oversight body is to look at the issue and see how best we can solve the problem. Now, your ministry is responsible for health service delivery, and then currently you are without about 371 of your staffs who are going on suspension. And you said PMO is the body responsible for the suspension, not the ministry. Now, you as the permanent secretary and your team, what do you have to tell us so that we can take an approach to see how best we can rescind this decision from the PMO and the staffs go back to work? And I think that is what we're supposed to discuss now so that we can conclude on this matter as soon as possible. Honorable Chair.
Question is of a similar thank you very much, Honorable Chair. My question is with regards to the 271 suspended public health officers. Recently, we went for a tour. We visited all the regions, and wherever we go, we hear from directors. They all complain about human resources, as we all know. So, 371 stars is suspended. Now, according to the people, they training people to do to supplement. I don't know. I don't think people are considering our people. Something effective, like 2 days ago. Is it okay? 2 days ago, I was called from my constituency, which is Cont Health Center. A pregnant lady was taken to the hospital at 2 a.m. and he did not get any. They did not see any nurse in the health center. They had to call me at the time. They called the police. They went there with the police, but they did not see anybody. And now, if like just same people are trained, you know, I think, you know, these people are not considering our people, to be honest. Thank you.
You have something? Yes. But you have been going and coming.
You come here.
Let me take it.
Thank you very much. I join my colleagues
we had a lot from these guys. I believe that there was a communication breakdown, and then the ministry did not respond to the need of our people. When these people went on strike, I think it was very important for the ministry to look at the modality of the strike and the impact it was going to have to our people. I don't know whether you guys are aware that this was not only a strike, it was more than a strike, because even the offices were closed, materials were not accessible. This was a huge problem that it had impacted in the life of our people. Even the common infant wear card was not accessed. A safety box is not accessed. And now, when we listened to them, all we could understand that there was no proper communication that have led to this gap. And I believe that the ministry should be ready and very active enough to have a contingency plan for issue of this nature. When they happen, what other plans are they going to do? Because there was no plan, everything stays like this up to today. Immunization is not taking place. Birth registration is not taking place. I believe that the ministry should be strong enough, should be more proactive when issue of this matter happen to address. Our people really suffered because of a communication gap. And I'm just urging the ministry to always have contingency plan issues of this nature when they happen, so that services does not suffer. And at the bottom line, we are the solutions to every problem we assume as National Assembly members. We want to work together to make sure that this problem is solved in a well-compromised manner. And I heard my auntie said, let's look and go back to the drawing board. Our code of conduct and ethics, this lack in our service delivery. What is the ministry doing towards ensuring that their people get affirmed with the code of conduct and ethics? Because I believe, both from the ministry and the striking force, there is something like in understanding the code of conduct and ethics. Because as a health worker, when it's that, we don't believe that if you want to look for money, you need to go into health. You have vowed your life to serve humanity. But in this context, that does not happen. Thank you.
I don't understand that. Okay, thank you very much, honorable members. And then I think we'll give PS the opportunity to respond to this, and then we come to a conclusion. Yeah, definitely. No more issues from the honorable members.
Yes, thank you very much, Honorable, for those questions. I think the way forward that we would recommend is that the ministry is engaging the PMO to reconsider this decision. So we would recommend that you also join us in calling on them to consider rescinding the decision. But also I would recommend that the suspended public health officers also understand that they have an obligation to the citizenry, irrespective of money, irrespective of whatever. Our primary responsibility as appointed civil servants is to put national interest first above all. So they need to understand that. Now, the other one is that services are affected, contingency planning. This we were dealing as a ministry, we knew we were dealing with a very sensitive issue. As we were negotiating, we are also calculating to delay certain manifestations that will even be seen as a bigger threat to them to warrant the aggravation of the situation. One of these is that if the moment they said, okay, and this stalemate was on, we jump into organizing teams, they feel threatened that they are being replaced. They are being replaced, and that can aggravate the situation. Now, we said, okay, let us continue to negotiate. Maybe they will understand before they see us physically replacing them on the ground. That was why we had to delay the putting in place a contingency. It's not that there is no contingency planning on, the contingency plan has been on, and the Director of Health Service has reported here that a contingent plan has already been done, and what is left is just to train. And that training, if they tell you, it's not that you will take 2 weeks, 3 weeks to train people to do this. No, because these are operations that need just refresher, orientation, to place people. But if we should jump in at an early stage prematurely to propose replacements, that will be even a threat. And in fact, some of their concerns, maybe they would have raised that as a concern. And we knew that was a sensitive area and we should not jump into it quickly. Yeah, the code of conduct, it has been noticed and realized that really knowledge about the government rule books is something that need to improve in our system. And we have taken a decision to engage the PMO and as well as to make copies of the government rule books, including code of conduct, the GO, the personnel procedures manual, civil service regulation, so that we make it available. And in fact, in the meeting that we had with the personnel management office, our minister recommended that they take it as part of their orientation, induction trainings to have targeted institutions for this kind of refresher programs, and it should be a continuous thing. And the Minister for Civil Service picked that up, and they said they are going to do it. But in the meantime, the ministry has taken the resolve to work with Personnel Management Office to get enough copies of these rule books and make sure whoever is employed is given a set, and at our own level we organize a way of sensitizing or orientating our teams. Thank you very much.
Before I give my concluding remark, let me just allow the Vice Chair to make a comment.
Okay. Thank you very much once again, Mr. Chair and PS and the team. Actually, mine will be a comment because we are at the tail end as far as this important meeting is concerned. But I just want to inform the gathering that we all have to understand that the Assembly is the apex authority in the Gambia. And we are empowered by the Constitution to exercise oversight over all institutions, including the President. And this needs to be known by everybody. Like the chair has said, we didn't call you here to tell you what to do, but to see what we can do together, because we are partners in development. And one thing that we also have to understand is that a problem that is not solved is still a problem. But a problem that is solved is no more a problem. And this we have to put at the back of our minds and see that the interests of our people, and I can be a little bit biased here, the interest of the people of Banjul North is my interest here. And I am here to address their needs and concerns. So whatever happened, by extension the Gambia, it is very important for us to understand that from the city of I don't care will always lead you to the town of Hadainun. And Hadainun is the mother of too late. We cannot fall or we cannot become victims of that Hadainun. And I believe as far as we are the apex authority of this country, it is important, like we are doing right now with you, to engage with you so that there will be a solution to this problem. And I believe from here, you will be able to work out. And also on our side, we'll be able to see and work out how to come up with a very tangible solution so that our people will get out of this situation. Thank you.
Thank you very much, Honorable Honorable Vice Chair. And then on that note, I want to express my gratitude and appreciation to the PS and team for leaving all your busy schedule to come and answer to the committee. And then on behalf of the National Assembly Authority, we want to thank you. And then we appreciate all that you've given us. But just as a way of conclusion, Honorable Jeng and Honorable Kora, you're making noise. If you are interested in the meeting anymore, can you please excuse us? Thank you very much. As a way of concluding, we've heard you and then we've heard the concerns of honorable members. The only way out is to engage the PMO. I don't know whether it will suffice. Public Service Commission, did they have any stake in this? The Public Service Commission? Okay, you can take note of it. The PMO and Public Service Commission, we will engage them. And obligation to the citizens with regards to the codes of conduct and then codes of ethics, that is to the entire general health workers, because it's an issue that have been coming up even during our tour in certain health centers. I think it's an issue that we need to take up with the ministry. We see what we can do together to make sure people respect what they are doing, people take their work seriously, and make sure we abide by the rules and regulations of wherever that we are working. That is very important, and that cannot just be brushed aside like that. The other thing is regarding the contingency plan that come from the ministry that the Director of Health Service has just said. I think it is important to have a contingency plan, but first of all, let us focus on the main issue, because we've taught the length and breadth of the country, any facility that we go, any regional health directorate that we go, the issue of human resources is always key that they will bring up. There are not enough staffs, there are not enough nurses, doctors, and here and there. So if you want to multitask them again, definitely that will definitely have an impact on the service. So let us do whatever it takes, not you only, even foremost, to make sure this issue is resolved and these people go back to work. And then we even recruit more people to make sure we deliver healthcare services to our people. And then I know that is the focus and the direction of the ministry, likewise us as an oversight. So on that note, I want to thank you again. And then I don't know whether Thursday, we want to schedule this meeting on Thursday, the meeting with the Public Service Commission and PMO. Not necessarily the entire team from the ministry, but we will need maybe some of your technical guys to come so that we can have a very fruitful discussion, maybe the PS, or maybe DPS, to help us in that meeting, because probably they might come and be telling us some certain technical issues from the ministry. So we will need somebody from the ministry to definitely help us on that. So we will send the letters today, and we will schedule the meeting on Thursday, and most probably we will copy you to make sure we have a representative from your area. Yes, on that note, I want to thank you, honorable members. Thank you very much. And then, in the absence of any other business, I just want to declare the meeting closed. I adjourn until Thursday at 10 o'clock. Thank you.